The term allergy is applied to a large number of diagnoses that can include problems with the nose, the skin, and the respiratory tract. In general, allergy is said to be a reaction to something that is not bothersome and usually okay for normal people. For example, people who are allergic to dust should not be allergic to dust. In general, dust is not an inherently bad substance, and neither is things like cat dander or dog dander. But in patients who have allergies, their bodies react abnormally to the substance that is inhaled or touched by the skin. This reaction will occur all the way at a cellular level. Certain cells within our bodies will react to particles in the air, and they release these kind of bad things into our bodies or into our blood, and we call them inflammatory mediators. And they basically cause things like sneezing, a runny nose, asthma attacks, rashes, problems with your stomach, and also occasionally things that can be very serious like tongue swelling and airway obstruction. Allergies are one of the many genetic diseases that occur in nature. If your parents have allergies, you may have had allergies. If your siblings have allergies, there's a fair chance you may have allergies as well. You have to realize, however, that even despite having a mother and a father or a brother or sister that have allergies, your chance of having allergies and not having allergies is still present. So if you look at national studies that are done as far as allergic rhinitis, approximately 20% of patients will have allergic rhinitis, and even more than 20%, about 50% of patients will have positive skin reacts when you allergy test them. So this makes this an extraordinarily common problem. So chances are, if you think you have allergies because you have symptoms of a runny nose or sneezing or itchy watery eyes or asthma attacks, there's a fairly good chance that you're right. Patients with allergies are generally diagnosed based upon their history, along with certain tests that the physician will use. So for example, if you come in to see a physician, you tell them every time you're exposed to a cat you sneeze, then you're probably allergic to a cat. Or if in every fall you sneeze and have a runny nose or have asthma attacks, you're probably allergic to some kind of weed, and the most common would be a ragweed allergy. If you're having problems in the spring, trees may be your problem, and if you're having problems in the summer, grasses may be your problem. Based upon this history, often allergy testing will be done either through blood test or through prick testing, and this can further confirm whether you have allergies to the things that you seem to have problems with when exposed to. There are multiple treatment options for allergies. We use multiple options in the oral form, such as pills like oral antihistamines, which are over-the-counter often, things like Zyrtec or Claritin. We occasionally will use prescription medicines, which are pills as well, such as Singulair or Xyzal, and occasionally we'll even use nasal sprays. If you're allergic to grasses or other types of inhaled allergens like this, another option for treatment would be to begin with allergy testing. In this procedure, we take a small prick device, we dip it into a solution that might have particles you might be allergic to, such as grass or dust or cat. The device is then placed in your skin. It's not a painful procedure at all. We do this to children over 4 years of age and also to adults. And what we do is we place this device on you, and some of the particles are injected underneath the skin. And if your skin swells up like a mosquito bite, then we know that you're allergic to grass. Another option to determine if you're allergic to grasses or other things like this is blood testing. Immunotherapy would be an option for treatment. So we do the allergy testing maybe to avoid things that you could avoid, like dust or cats or dogs. But on occasion, and very frequently, patients are allergic to multiple things, and therefore we recommend immunotherapy, which is basically a desensitization process in which we either inject or place underneath your tongue the things that you're allergic to. We start off at a very small dose and then increase this into larger and larger concentrations of what it is that you're allergic to. So for example, if you're allergic to grass, we would start you out at a very small concentration and every week double it, and then double that, and so on and so forth until you're getting a very huge dose of what you're allergic to. And what this does is, over time, it teaches your body not to overreact to the substance that is causing you problems. So if you have an allergy to something like dust that shouldn't be causing sneezing or asthma, then over time, with this immunotherapy, with this greater and greater concentration that you inject or ingest of what you're allergic to, your body will no longer have sneezing or asthmatic symptoms whenever you're exposed to that antigen. And if you look at patients over time who have immunotherapy, with the studies that have been done, their use of medication and their symptoms of overall well-being improve. So they tend to use less medications for their asthma and their allergic rhinitis, and they tend to feel better all in all. You can do weekly injections for this, in which you come into our clinic once a week and get injections. Or you can do sublingual immunotherapy, which is basically a treatment that we do underneath the tongue at home because it is so safe. What I would tell patients with allergies is that not all allergies are created equal. Multiple people will tell you that they have allergies and they just deal with it, or they take a pill and make them feel better. But this doesn't necessarily mean that they have the same disease as you. Allergies can be anything from a nuisance to a fatal reaction from a bee sting or an inhalation in an asthmatic. In fact, multiple people per year die from asthma, although this is the exception. But if you're having allergy problems that are causing you to feel bad or limiting your ability to do things, and you feel like your health is impacted by this allergic disease, then you should see somebody who specializes in treatment of allergies. Allergies are a fact of life in the South. Each season seems to bring different conditions, and in our clinic, we're one of the few clinics that actually offers sublingual immunotherapy. We've been doing this therapy for several years in our clinic, and we've had wide experience from treating multiple different conditions, from seasonal allergies such as tree and dust and ragweed allergy to cat allergy and grass allergy. It's advantageous for children because the therapy can be done at home and it doesn't require shots. And they also are able to put the solution underneath their tongue, and it's very sweet, and so children tend to like to do it. But the biggest thing, I think, in choosing the right doctor is finding somebody who has experience with treating this particular condition. You want somebody who's up to date on all the multiple treatment options and has a very vast clinic experience in treating this.